I see other participants are joining us. If you are able to respond to the poll, you got a few more seconds. Okay, I think it is safe for us to go ahead and close the poll. Awesome. So what I have on my screen is self-medicating, complex, coping, still winning, stigma, strategy, compromising, and management. Hopefully during our discussion today, we will be able to talk through some of these things that you all have shared. I appreciate you participating in the poll as you were able. It is 3:31, so welcome to the Mental Health, Alcohol, and Drugs and How Do They Connect conversation, if you will. My name is Dr. Charla Blumel. I'm the Assistant Director of Health Promotion and Prevention Strategies here at Student Wellness. And today I'm going to be helping to frame and moderate our conversation. First and foremost, we want to say thank you, and we are very grateful to the Carolina community for hanging out with us today, faculty, staff, and students, and especially our wonderful panelist and faculty presenter. A little bit of background on the mental health series. So the mental health series is a follow-up to November 2021 Mental Health Summit, where we heard some broad information around mental health in our community. The seminars are intended to provide more in-depth conversation about the intersection of mental health with various factors. Our first seminar of the semester was the intersection of mental health, faith, and spirituality. Specifically for today, we are creating space for us to talk about the intersection of alcohol, drugs, and mental health. The plan for our conversation will start with some brief introductions of our faculty presenter and panelists, and then I will continue to outline some logistics for our webinar and explain how you can participate. I will go over some of the framing of today's topics before passing it over to the expert panelists to discuss the topic in further detail. After our panelists present, we will open the floor for some Q&A. As we navigate this conversation, some things to keep in mind. When we talk about mental health, it can often be a very sensitive topic. Our aim is to support each other around what may be deemed sensitive. We hope that participants here live and watching the recording later will prioritize self-care and their participation. And if you need to step away for a moment, please do so. We are recording all but the Q&A portion of this program, so you can always revisit the sections you have missed. I am joined today by a faculty presenter and three panelists. Our faculty presenter is Dr. Stacey Darbs, a professor in the Department of Psychology and Neuroscience as a clinical psychologist. Wendy Cadens is a clinical social worker at CAPS. Heather Gallagher is a clinical addiction specialist at the UNC's Alcohol and Substance Abuse Program, also known as ASAP. And Dean Blackburn is the Director of Student Wellness and Associate Dean of Students. Welcome, everyone. We have a wonderful lineup. I'm very excited about the conversation, and I hope you are as well. Again, I want to welcome your participation today. We will use Poll Everywhere to gather your thoughts and your responses to some of our conversation topics. The polls will be available via your phone or your computer browser. Please use the Q&A function to chat with the production team if you are having any trouble with the polls. The Q&A feature is open during our entire time together for you to submit any questions or comments that you may have. Most questions will be responded to during the Q&A section of our program. We will not record that section of the conversation and devote the Q&A to hopes to give all attendees the space to share and to ask questions that you may have without those being preserved. The main portion of the presentation will be available after today via YouTube video and also to be shared on care.unc.edu. I also want to mention the Hills Care Network. When you visit care.unc.edu, You should be able to find an outstanding collection of information to support all members of the Carolina community in their mental health and well-being. On the website, you can find a resource hub, care referral form, and other events. And you can also find a link in the chat. As we have mentioned, today's purpose is to discuss the intersection of alcohol, drugs, and mental health. We will also have resources to offer. A few things to keep in mind. In the last few years, several things have been illuminated for us, some more than others, and this intersection specifically may be something of concern for those who are on our call today, whether that be a personal concern, a peer concern, family, friend, etc. We want to note that our students are not a monolith, and as communities within communities that contain individuals, everyone's experience as it relates to these topics will be different. So, last but not least, for everyone's information, something to consider. Here recently, we have conducted the Color of Drinking survey at UNC Chapel Hill to discuss the mental health impacts and retention concerns connected to a lack of support and resources for target populations, specifically our BIPOC students and other minoritized groups such as the LGBTQ students. A full report will be coming, and you will likely see a DTH article sometime this week with an overview. All right, so we have another poll question before we start with our faculty presenter, and we want to hear from you. So please take out your phone, navigate to pollv.com/heals to respond, or text your response to 22333. Using the keywords HEAL and A or B to note your response to the question. Do you know anyone experiencing challenges with the intersection of mental health, alcohol, and drugs? All right, let's give it about 30 more seconds. Okay, I think we can go ahead and close the poll. All right, so based on folks who responded, 93% of you have indicated yes to this question and 7% no. I think that is a bittersweet thing for us, right? In the sense that we all understand and know the challenges around this and are possibly connected to someone who is experiencing his challenges, but it also hopefully will create a more robust conversation between all of us to share strategies and resources on how we can support the greater community and the people that we really do care about. So with that being said, I will turn it over to Dr. Stacey Darbs.
Okay, hello everybody. Thank you for being here today, and I'm looking forward to having this conversation about two very important topics, mental health and substance use, and how they connect. Just a word about who I am. As mentioned, I am a professor in the Department of Psychology and Neuroscience. I'm also a licensed clinical psychologist, and my expertise is in the development of interventions for substance use and testing the effectiveness of interventions, and also identifying what characteristics put individuals at risk for having a substance use disorder and also have difficulty recovering from substance use disorders. So today I'm going to talk about three main topics here. First, just an overview of substance use rates, what's actually happening out there, both in the larger adult community and among young adults, and then some definitions regarding substance use rates as far as what's normative alcohol use or binge drinking, for instance, and also what these symptoms are for a substance use disorder. Then I'll get into a bit about, the cyclical relationship among mental health symptoms and substance use. Why and how are they related? And then what are a few habits that are known to help prevent mental health and substance use problems. And the panelists will talk a little bit more about resources and treatments once a substance use problem develops. But today I'll just focus a little bit on things that can be done prevention-wise. So starting with, there are a number of drug classes, and I'm going to name a few here first, talking about tobacco use, alcohol, and then illicit drug use, and get into the specifics. But here you'll see that 35% of young adults, age 18 to 25, are using tobacco use or vaping. And the vaping number down here you can see is particularly high among 18 to 25-year-olds compared to other age groups. So these rates are still pretty high. I mean, the general population, about 20%. And then for illicit drug use, we have about 20% of adults in the general community, but for young adults, it's up to about 37%. And illicit drug use categories include illegal substances such as marijuana in some states, and not all though, prescription pain medicines that are misused or not prescribed, hallucinogens, tranquilizers, cocaine, other stimulants, and depressants that are not legal. And then in terms of alcohol use, there are high rates continuing of alcohol use, and particularly among young adults, and also adults, it has increased significantly, in particular during the pandemic. But there's a lot of question about this is kind of one of those gray areas for substance use, is what is alcohol, safe or okay, normative alcohol use. And so I put a few definitions up here. Drinking in moderation is defined as 2 or 1, depending if you're male or female, drinks or less in a day. Binge drinking is 5 or 4 drinks, depending on your male or female, on the same occasion at least one day in the past 30 days. And heavy alcohol use is engaging in binge drinking on 5 or more days in the past month. And you can see here from this chart that for adults 26 or older, rates of binge alcohol use are about 23%, and heavy use is about 7%. And then for young adults 18 to 25, the binge alcohol use rates are particularly high, higher than other adults, and heavy alcohol use is also higher, but not quite as disparate from as binge alcohol use. Now, the statistics that I just shared with you are general use statistics, and use in the past year at least once is what was reported there for at least illicit drug use and tobacco and vaping, and that use starts to become a little bit more problematic as it increases in frequency. And so the question is, how is one to know if their use is starting to become problematic? And here are some of the symptoms that are used to determine if someone meets criteria for a substance use disorder and things to look out for. So first, are you or someone taking substances in a larger amount or for a longer time than intended? Someone who wants to stop or cut back but is unable to do so. So repeated attempts to say, okay, I'm going to cut down on my drinking or my substance use, and then continuing to do so anyway. And a big one is giving up substance-free interests or obligations, right? So not going to classes or not showing up for work, or maybe you used to run a lot and suddenly you're not running anymore. So really giving up those activities and obligations that are important. Having regular cravings when you're not using the substance is a key criteria. And then also an increase in problems related to substance use. So interpersonal problems. Are you getting in arguments with close people in your life? Are they concerned about your substance use? Are you engaging in risky behavior? Maybe drinking and driving, or risky sexual behavior? Are you experiencing physical or psychological problems? We know that substances can lead to negative health outcomes. Are those occurring and then you're continuing to use anyway? That would be, that's a problematic symptom if you start to notice that. And then finally, tolerance and withdrawal. So tolerance is needing more of the substance than you used to get the desired effect. And then withdrawal symptoms is when you stop using a substance, you start to feel agitated or uncomfortable, both emotionally or physically, until you get the substance again. And to meet criteria for a substance use disorder, you just need to have 2 of these symptoms to have a mild substance use disorder. We also know that substance use disorder is prevalent. So 7.2% of the population meets criteria for a substance use disorder. And a lot of people are surprised to know that this is higher than rates of major depressive disorder. So it's fairly close here, but more people in the US meet criteria for a substance use disorder than major depression. And you can see how this is broken down here across drug classes. So the most being alcohol, and then here are more specific illicit drugs. So how do mental health symptoms and substance use relate to one another? So first, of the individuals, the adults in the country that have a substance use disorder, 38% also have a mental illness. And among those with a mental illness, 18% have a substance use disorder. So these are commonly co-occurring. And having a mental, now that's just a disorder, right? Meaning criteria for a clinical disorder. But here, having a mental illness increases the likelihood of any substance use. So you'll see the blue bars here are individuals with no mental illness. Yellow are any mental illness, and red are severe mental illness, such as schizophrenia or bipolar, psychotic disorders. And there's significantly higher rates of any substance use or mental health condition among individuals who are using substances across substances. And even here, cigarettes, nicotine use. So some people consider that a little bit different and not as serious, but it really is. And it's related to mental health illness, is the same amount or disparity as some of these other substances that people deem to be a little bit more concerning. And we know that substance use disorder is associated with suicidal thoughts, plans, and attempts. So here, if you don't have a substance use disorder, you're the blue bars, and if you do, you are the green. And you'll see that individuals with substance use disorder are significantly more likely to have serious thoughts, a plan, or an attempt, a suicide attempt. And among university students, we know that mental health and substance use co-occurrence is a growing problem. 1/3 of students meet clinical criteria for anxiety or depression, and co-occurring mental illness and illicit substance use has increased by 22% in the past 3 years. So how and why are mental health symptoms, do they increase risk for substance use? And one way to figure that out is to think about what motivates substance use. And what we do know is, first, individuals use substances to feel good. They can increase feelings of euphoria, increase energy and focus, creativity, just to name a few. And we also know that people use substances to feel better, right? So if you are feeling anxious, stressed, depressed, substances can numb those feelings and kind of mitigate those difficult emotions. In a very recent study, it was shown that college students are more likely to engage in substance use in the moments right after experiencing more positive or negative mood than normal. Okay, so sometimes it's not just the experience of mood, but the intensity of it. If it's positive mood, just wanting to keep that going, or negative mood, wanting to get rid of it. If it's outside what is the normal experience. And it's important to keep in mind that substance use is a learned behavior. And that's why we think about what motivates substance use is, why did individuals learn that it works for them, right? So initially there's a purpose there for substance use. And then over time, though, that becomes problematic and it becomes difficult to unlearn that behavior. And I recommend this book by Maya Salovitz on broken brain if you want to read more about the idea of substance use being a learned behavior. It's quite good. So we also know substance use can make mental health symptoms worse. And why is that? So over time, substance use can lead to neuroadaptations in the brain that are related to some of the reasons why people use substances to begin with. So one being sense of pleasure. So there's reduced sensitivity to natural rewards. If you're using substances regularly, your body becomes used to needing those substances in order to feel good and to feel motivated, and it decreases the motivation and enjoyment of substance-free activities. We also know that it increases negative mood and stress reactivity. The normal neural processes that we need to help us maintain a stable mood and not react to difficult situations is depleted. So we have increased feelings of stress, anxiety, anhedonia, not feeling pleasure, and depression. And also cognitive deficits can occur with repeated substance use. So we know that it impacts the prefrontal cortex, it increases impulsivity, it reduces our flexibility and planning ability. So when I say flexibility, it's where you get a new information and can make sense of it and make a decision adaptively. This reduced flexibility, cognitive flexibility, means that an individual who's using substances suddenly sees a cue that they want to use again, and they're unable to adapt and to make a decision based on what's best for them due to some of the cognitive deficits associated with substance use. And then attentional bias and craving. And why these matter is that it then leads to an exacerbation of substance use again, which then increase more, your stress, as well as reduce your experience of reward for non-substance activities. And it's a vicious cycle that can then continue to exacerbate mental health symptoms and substance use. So what are some things that we can do to prevent the increase or onset of mental health and substance use symptoms? And here are just a few. So first, responding to difficult emotions, learning to respond adaptively. So mindfulness and meditation is one way to do that. The idea being that we want to create space between the difficult emotion or situation that occurs and our response to it. And mindfulness and meditation is incredibly helpful for that. Increasing opportunities for experiencing positive emotions, practicing gratitude. We know that works very well for increasing positive emotions. Also investing in your community and relationships with others. Value-based living. So planning activities each day that give you a sense of enjoyment or accomplishment. We know by just planning 1 or 2 activities per day ahead of time that are in line with your values can decrease the likelihood that you'll experience depression or other negative emotions, which then will impact the likelihood that you'll engage in substance use. And also to reduce stigma related to substance use. So discussing substance use as a mental health symptom and avoiding stigmatizing language. We're talking about them separately a bit here today, but really it's important to note that that substance use is a mental health problem or condition, and talking about it as such and normalizing it so that you and other individuals are comfortable discussing and opening up about their substance use, and then getting the help that they need. And that's all I have for this part of the presentation, and I'll look forward to answering some questions and hearing from others.
Great. Thank you, Dr. Darbs. We do definitely appreciate that information. I think what stuck out for me is those strategies are probably all things that we can all get behind and we maybe believe in as central to like health and well-being and what's important to us. So these type of conversations help me, and I think help us be reminded of that. Like we can do these things together. These are not things that are familiar to us, but we also may need additional support to navigate those things and remember that they're important and remember, how to access them. Great. So before we move to the panel, we have another quick poll. So take your phone out. Oh, you're already doing it ahead of the game. I love it. I love it. So the question is, what can you think of that might help support people who are struggling to manage mental health, alcohol, and drugs? That makes me happy. I see that word community really big, and I probably said it like 20 times since we've been talking. So my Jedi mind tricks are working. Very good. Support, therapy, being kind. That might say being direct, resources, CAPS, shout out to CAPS. Listening, like-minded, being involved, activities. Very good. Let's give it maybe 30 more seconds. I see the word consistent. I like that. I see empathy. I like that as well. Okay, I think we can go ahead and close the poll. Thank you all so much for your participation. All right, so let's get in touch with our panel a little bit so they can give us some more of this amazing and good information. So I want to go ahead and start with Wendy. Wendy, as you are ready, please share with us all the wonderful things and all the knowledge that you have.
Just that, just share all the knowledge I have. I don't know if that'll be probably a very short presentation, but hello all. I'm really glad that so many folks are here to talk about this, and really grateful for our presenters and panel and Charla for keeping us on track. So I am a clinical social worker and one of the staff therapists at Counseling and Psychological Services. So I'll speak primarily to what we see and respond in regard to students. But I do want to share just first and foremost, and I'll talk a little bit after about how to connect with us. But any person can call CAPS with a concern about another student. We are there to support pretty much only students, postdocs, grad students, any kind of student on campus. But if you are a staff member or a faculty or a parent or any member of the community that we just identified as so important, please feel free to call CAPS and share your concerns, ask questions. We're here for that as well. So I think, that one of the points I just really want to highlight and pull out in what we see with students who are coming in, I think that Dr. Daughters laid out the statistics, and we are seeing at least a 30% increase, as she indicated, in folks coming in with anxiety, depression, substance use concerns, all of that. The pandemic is, this was not normal for anyone, but I personally think it was particularly not normal for students, right? They missed graduations, proms, they missed, first years on campus, they missed a lot of things that were typical. And what we see a lot with substance use is that they're trying their best to solve a problem, right? That they're leaning into substances because something else is uncomfortable or feels intolerable or is just like mind-blowingly different from any other experience that they may have had, right? So it's not or when it becomes problematic, it's often because they are doing the very best they can to cope with a reality that may not be what they signed on for or expected. So we try to approach all of this with curiosity, with kindness, with listening, with building community, right? All of the things you all identified fall into the area that CAPS is trying to support growth and development in. And one of the things that I often say is that it's a really normal instinct when something hurts to want to avoid it, right? Like you put your hand on a hot stove, you pull it away to avoid that pain. The problem is that that doesn't work very well with emotions. If you're dealing with hard emotional content, with a history of trauma, with a mental illness, with the world being a really challenging place to be a young adult in, when you're dealing with all of the, what came with the pandemic, with the racial violence in the country, with war now, with all of this going on, of course you want to pull away. Of course you want to not interact. The problem is when it comes to emotional concerns, what we resist persists is one of the sayings in psychotherapy. And so we need to help students and help each other learn how to lean into that instead. We have to be able to explore. We have to be able to talk about it. We have to be able to listen to each other and sort of be like, yeah, this is hard. These are real problems. Let's help each other figure them out. Right. So that's a lot of what we are trying to do and help students to do for themselves and for each other when they're coming in. So just really want to, sort of normalize that that's a normal, understandable reaction. And the more you try and not think about it, the bigger it gets. It's like trying to put a cork in a volcano, right? It doesn't make the lava go away. It just makes the pressure build and then the mountain blows. So we're here to help students figure that out, to help you figure out if a student needs that. Just a quick, make sure everybody knows how to access CAPS. So students can walk in or phone, but preferably they'll come to CAPS physically, and they will be able to fill out a bunch of bubble dots, a lot of questions on a computer. It usually takes about 20 minutes, just so we have a sense of what's going on. And then you meet with a counselor, usually again, 15, 20 minutes, maybe longer if what's needed, with the goal of figuring out what the best next steps are for you. There is no charge for doing this. You can come in from 9 to noon and 1 to 4. And meet with someone, fill out that paperwork, meet with them. It is completely confidential. We're one of the few truly confidential spaces on campus. So unless a student is at imminent risk to themselves or someone else, or they disclose neglect or abuse of a child or an older adult, other than that, we don't call parents, we don't call professors, we're not talking to other folks. We're maintaining confidentiality and truly focused on finding you or the student the best possible next step. And sometimes that's us, and sometimes it's a group, and sometimes it might be a referral, and you'll hear more about some of the folks that can help with those referrals. Substance use is the primary concern. And I think that's it for me. That's all my knowledge, Charlotte. That's all I got. You got everything now.
Perfect.
Thank
now
you.
I can take it and run away. Thank you so much for sharing that, Wendy. I really do appreciate it. And I think really important for our students to hear about the compassion and the empathy that they can receive at CAPS, and see you all as a friend and a confidant in what is going on to support their well-being. So next, I want to turn it over to Heather. Heather, whenever you're ready.
Thank you so much. So as Charlotte said, my name is Heather Gallagher. I'm a licensed clinical mental health counselor and a licensed clinical addiction specialist. And I work for the ASAP program, which is the Alcohol and Substance Abuse Program. And we're affiliated with UNC Healthcare. So my goal today is to explain a little bit about what we do at ASAP, and then I'll also provide you with some other resources in the community. So our alcohol and substance abuse program, we see individuals with a primary substance use disorder, but more often than not, there's a secondary mental health disorder as well. So someone may come in for alcohol or another substance, but they may also have depression, anxiety, bipolar disorder. And if you were to make an appointment with us, you would come in, we would complete a comprehensive clinical assessment where we just go through and ask you all kinds of questions, get to know you a little bit better, really just to make sure that we're a good fit for you. And if not, then to help you find the best fit in the community. At ASAP, we have both individual and group therapy, and we're a mix of virtual and in person right now. So we're going to find what works best with your schedule, with your comfort level. And then we work with teens and adults of all ages. So I think right now I'm seeing individuals between ages 15 and 85. So really everyone but kids. And if you'd like to make an appointment with us, you can easily just give us a call and we'll help you schedule that. I mentioned that ASAP is outpatient therapy. So I do want to quickly describe some of the levels of care in substance use and mental health treatment and what they offer. So individual therapy is going to be really therapy with the least structure. So you may be meeting with a therapist once a week, once every other week. Kind of a step up from that, we have outpatient therapy, which is what we provide at ASAP. So individual groups, we have groups that meet every day of the week, but typically if you're coming to our program, you're going to 1 to 3 groups. Kind of a step up from that is going to be intensive outpatient or IOP. And that's something that typically meets 3 times a week for about 3 hours each time. More often than not, you're in an IOP for around 3 months. And then kind of the next step up would be a partial hospitalization program, which is really just a day program of treatment. So you might go to treatment from 9 in the morning till 3 in the afternoon, Monday through Friday. You'll usually do that for a couple of weeks. And then finally, at the top, we have detox and residential treatment. So detox is going to be important for those who may not be able to stop using a substance on their own safely. They need medical monitoring or medical intervention. And then residential treatment is typically about a month's stay. And the reason that someone might go to a higher level of care like a residential treatment is if there are safety concerns. So there may be safety concerns from a mental health standpoint or from using substances as well. And sometimes those lower level of cares, the individual treatment, the group treatment, it may not be enough structure, or they may have needs that just can't be met by that level of care. So that's when we would refer to something a little bit higher. So how do we access treatment? If you have insurance, if you look at the back of your insurance card, there's typically a mental health number you can call. You can find providers who are in network with you. Another option, if you are looking for individual therapy or even some group therapy, if you visit psychologytoday.com, it's a resource where you can filter based on insurance, based on modality of therapy, based on location, and you're able to find someone who you may be able to work with. CAPS and campus recovery are a great resource for those of you on campus. There's also SAMHSA, which is the Substance Abuse and Mental Health Services Administration. It's a government organization, and they have a treatment locator on there. So again, you can filter by location, you can filter by types of treatment, and they can help you find what you need. And then there's also crisis resources in our area. So if needed, a mobile crisis unit can come out to where you are. But then each county also has crisis centers that offer walk-in assessments, and then they'll help to refer you to additional resources if needed. The crisis center for Orange County is going to be located at Freedom House, which is in Chapel Hill. And then I just want to quickly talk about some self-help options as well. So self-help options are great either in addition to therapy, or for some people in lieu of therapy. They find this to be particularly helpful. So many people are familiar with AA and NA. That's going to be Alcoholics Anonymous and Narcotics Anonymous. They have meetings virtually, in person, literally any time of day you can imagine. You can find a meeting. And then there's also Al-Anon, which is great for family members or anyone who's really worried about someone in their life who's using substances. It's a great place to find support. There is Smart Recovery, SMART, and this is a great tool. This is still self-help, it's peer-led, but it's not 12-step based. It follows a very cognitive model. It's a cognitive approach. It gives you tools for change. There's some education as well. And then the last resource I'll leave you with is NAMI, which is the National Alliance on Mental Illness. And they have support groups. If you Google NAMI North Carolina, it'll show you some local chapters. I think there's one for each county, and there's education groups, there's support groups. This can be for family or friends of loved ones with mental illness, or if you have a mental health concern yourself, there are support groups there as well. So I think that is all I have.
Thank you, Heather. That's so helpful. I love all of those resources that you provided, and especially NAMI, it really has some strong identity-based resources. So for folks that those things are important or salient to you, and you specifically would like to have an African-American therapist, and or you are specifically looking for someone who works with the Muslim community, or anything and all the things in between, I think NAMI is a really good place to start. Okay, last but certainly not least, I want to turn it over to Dean Blackburn. So Dean, whenever you're ready.
Thank you, Dr. Blumel, and thank you all the rest of our panel members. I'll start with a brief overview of our office. And so on every campus across the country, there is an office or a service that does both prevention work. So they really work hard with partners across the campus to create an atmosphere that reduces the likelihood of either someone experiencing too much mental distress. So we might do stress relief, we might teach mindfulness, those sort of things, but they also work to help reduce the risk associated with the maybe misuse or overuse of alcohol or other substances. Our office does that prevention work. There are also offices across most campuses that do what we call early identification and intervention work. And that can look a lot of different ways. That can include brief screenings. It could include brief therapy or referral and assessment. Our office also does that work for Carolina, along with CAPS. And then many campuses, about 150 at this point across the country, have been developing collegiate recovery programs. And those are programs that support specifically students who are largely in abstinence-based recovery from a previous substance use disorder diagnosis. So we kind of cover that full spectrum. And I'm really grateful that Carolina has the resources and that we're able to provide that full continuum for the campus community and specifically for our students on campus. Secondly, I'll talk about the fact that there's still plenty of taboos and stigma around issues of both mental health and substance use, and certainly the intersections of those. And we've done a lot of work at Carolina to do our best to reduce some of those stigmas and to reduce the barriers to accessing help. And so I'm really proud to say that the greater Carolina, the greater university, has a growing understanding that both mental health and substance use disorder, as under the umbrella of mental health, are medical conditions. They are not moral conditions. And so when one of our campus members struggles with depression or anxiety or substance use related matters, we don't judge that. We are able to understand that and meet folks where they are and really provide the confidential support and encouragement for what they might need to both access resources, but also stay connected and remain an active member of the community. So I want to say that because I want to make sure that we continue to reduce the stigma and reduce the barriers that would let someone reach out to CAPS or our office or Dean of Students or Heather's agency, ASAP, or many faculty members or other staff like advisors around campus. Please find someone you trust and know that you can talk with them without fear of any repercussions related to seeking some support for your mental health and or substance related issues. I think the other thing that's important to talk about when we talk about the co-occurrence of mental health or mental health conditions, including substance use, and I'll say substance use and substance use disorders because there's there's the use, and there's the use that might be problematic, and then there's the use that might become dependent, or what we might consider a disorder as described earlier. Oftentimes we might seek help in one or the other. Like we think, if I could only get my depression under control, I'll be okay. If I could only manage my anxiety, I'd be okay. Or maybe even if I only get my drinking or other substance use under control, my mood or anxiety would be okay. And the reality is we really need to approach those, as I think was shared earlier, as a common condition, a co-occurring condition that needs treatment altogether. So I will say that, you know, if you're a student or faculty or staff member and you are seeking help for yourself or someone else, be sure to find somewhere that you can share openly everything that's going on. So if you are experiencing depression, anxiety, or other mental health conditions, if you are also consuming alcohol or other substances at any rate, doesn't even have to be, you know, self-identified problematic, but at any rate, be sure to share all of that with the provider so they have all the information necessary to assist you in the best way possible. And then the last thing I'll add at this point would be sort of the importance of making sure that you are talking with someone. I think Wendy or someone may have previously shared that sometimes both mental health and substance use disorders can create disconnection. And we know that one of the most helpful things is reconnecting. And so whether you've disconnected from things you used to enjoy, or you've pulled back from communities that you have been involved with, do something to reach out and connect with another person in that process. If you want to get connected with student wellness, specifically around substance use issues, and again, we can be confidential specifically around substance use issues, you can either email studentwellness@unc.edu, you can call us at 919-962-WELL or 962-9355, or reach out on our website at studentwellness.unc.edu. I'll pause there for now and look forward to some questions, and hopefully we can continue to contribute to the conversation. Thank you.
Perfect. Thank you, Dina. I appreciate that. And as all the panelists have said, and Dina said, definitely talk to people, figure out what is going to work for you. And if you're not sure, ask questions. That's why we're here. We're here to support you. We're here to support our students. We don't want anyone to feel as though they have to navigate any of the conversation, any of the resources, and any of the support alone or by themselves. So before we move forward with our Q&A, we do have one more poll question. So as you are ready, did anything you have heard today surprise you? Any surprises? And if there were some surprises, it may be that you want to submit a question to get some further clarification around that, or maybe more details. All right, a few more seconds. Okay, our poll looks stable. I think we are safe to close it. Oh, I spoke too soon. Okay, so by and large, not a lot of surprises, but some folks who may have some more things to think about, reflect on, or in this moment, get their question answered. So we do have currently one question, and oh, let's see. Dr. Daughters, do you want to come off mute and I can go ahead and read it out loud? Perfect. When it comes to breaking a repetitive / addictive cycle, is there a science-based length when cravings or withdrawal symptoms end? I.e., is there a magic number of days of going clean until it gets progressively easier to solidify a good habit or stop a bad habit?
That is a great question. And we do know that with every day that passes, withdrawal symptoms and cravings get better. We do not have a magic number of days because that really can differ across substances, whether it's alcohol or cocaine or prescription drugs like opiates, for instance.
I just want to provide you with some information. We will host our next seminar on the intersection of mental health and interpersonal violence on April 20th. We will also host a mental health colloquium as we revisit themes from the Mental Health Summit in our spring semester seminar series. The colloquium will occur on the first day, reading day, April 28th from 12 to 3:30, and details will be shared about both events on the Heals Care website. So with that, I will also ask if our panelists would like to offer one last nugget or sage piece of advice to close us out before we go. No pressure.
Dr. Blumel, I might offer this for any student who may be listening or any faculty or staff who may be working with a student. If a student is interested in talking with another peer who has gone through a process of experiencing substance use disorder and is currently working successfully with that being sort of, managed or under arrest, if you will, in remission, we have a group of students on campus who would be willing to talk with them anonymously, confidentially as well. So I think, as Wendy said earlier, if you're not completely comfortable yet talking with a staff person on campus, know that there are a number of peers who'd be happy to support you and share their experience with you, also help you get connected as well.
Great, thank you. Anyone else?
I'll also kind of piggyback on that. I know I've gotten questions before, I don't know if I meet diagnostic criteria. I don't know if therapy is appropriate. And there's nothing wrong with making an appointment and just talking to one of us, or like Dean said, talking to a student on campus. I think you have nothing to lose. I'm not going to force therapy on you. I'll just provide you with options.
Nice, thank you. Okay. Thank you. Oh, wait, Wendy, go ahead. I saw you come off mute.
No, it was fine. I was just gonna, again, thank you, Dr. Blumel, but just to say, if you're wondering, if you're curious, just find whatever point of entry feels right for you. Anywhere you feel safe is okay. A good place to start, and
Right.
be kind to yourself.
I think that is our sage advice for all things, but especially this. Be kind to yourself. We can often be our own worst critic. That negative self-talk often comes from us inside. So really just thinking about talking to yourself like you would talk to someone you care about. You would give them all the grace and the space and patience and kindness, and just turning some of that inwards. I think that's really important. So I appreciate you sharing that. But with that being said, and no questions, in my community, in the church, we say all minds, hearts are clear. And if everyone nods yes, then that means we can adjourn and move on to the next thing. Perfect. Thank you all again. I hope everyone has a splendid rest of their afternoon and enjoys the rest of this beautiful day. Take care.